Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Clarithromycin, also known as Biaxin. It's an antibiotic. It can be used to treat anything from H. pylori, which is a stomach infection, to bronchitis, to otitis media, tonsillitis, pharyngitis, pneumonia, different skin infections. It's a broad spectrum antibiotic that can hit all kinds of gram-positive, gram-negative bacteria. It works by inhibiting the protein synthesis. So it essentially interferes with the bacteria's ability to be able to grow and replicate. So if you do that, you can kill the bacteria, yay, it dies. You can take it with or without meals. Obviously, if it causes issues with your stomach, you want to take it with a meal to create that buffer. Immediate release versions of this medication peak in about 2 to 3 hours, so it can come on pretty quick. Extended releases can peak anywhere from 5 to 8 hours, but then, if it's an extended release, you're maybe only taking it once, maybe twice a day. Immediate releases, I think I've only seen it up to once or twice a day too. Again, you take the ER and the IR versions depending on what you have, right? So I'm going to leave that for the doctors. I don't want to step on any feet. If you have any renal issues, you can take this medication without a problem usually. With liver, you generally don't take this medication if you have any sort of a compromised liver situation, or if you're taking a lot of medications that go through the liver, then this may not be the best antibiotic to take. Pregnancy is generally not recommended. It crosses the placenta, it can get into the baby. We don't want that. If for women that are lactating, there is such thing as a relative infant dose, right? So as long as it's under that limit, baby can get that amount of medication going in without too many side effects. But if it's over if there's over the limit, then there's going to be unwanted side effects that the baby can get. So not cool. We want to make sure that you're measuring. You go to the doctor and you're getting your breast milk levels kind of measured to make sure that there's not too much of that antibiotic getting through. Here's a list of side effects here. Main one is it's just the same as any other antibiotic, GI issues, right? When you are taking an antibiotic, it's kind of like nuking your GI system. It's going to kill everything. It's going to kill bacteria, good and bad, because there is a lot of good bacteria that's sitting in our intestines. And so it'll kill it, which is why the doctor may say, hey, you should take a probiotic with an antibiotic course or eat yogurt and things like that, because we want to balance, we want to bring some of that good bacteria back in the body if this antibiotic is going to go in and just really just kill everything, right? So just watch out for that. Obviously, drinking alcohol and things like that will decrease the effectiveness of it. Question we get a lot, and there's always varying results to it, is what about my vitamins and minerals? Generally, what I tell my patients is to take your vitamins and minerals 2 hours before your antibiotic dose, or anywhere from 2 to 4 hours after. The longer you wait, the better, because it gives your body a chance to digest the antibiotic and kind of process it. The vitamins and minerals tend to interact with the antibiotics, decreasing the effectiveness of it, and we don't want that, right? We want your antibiotic to be as effective as possible because we need it to kill what it needs to kill so that you can go back to being 100%. Right? So guys, I think that's it. Comments, concerns, leave them down below. Hit subscribe, let us know how we're doing, and we'll see you next time on Meds Made Easy. Bye.